If a patient came into your office wanting to know which Christ they should use to treat their arthritis or to treat their psoriasis, what would you recommend? Now, obviously, you wouldn't recommend lidocaine or a aspirin. Well, I don't know, maybe not, probably not. Aspirin cream. You'd probably go with cortisone. You'd probably go with a cortisone Christ because that's what these creams, these ointments are. They're Christs. So this is a normal treatment approach. Now the problem is that it really goes against what these guys believe. The nature of a Christ for these guys. They think that they can. Well, listen, I don't know. Listen, you know how they are. So this is a real Christ. They just can't take it. And this is a mystical Christing that Jesus did in Revelation 3:18. This is a medical Christ. So we're talking about a medical Christing in this video, right? This guy couldn't see, so Jesus Christed his eyes, and the dude could see. There's no mystical, mania thing that went on with this, the ostromania business that goes on with the mystical, or allegedly the mystical, I don't know. This is just medical. So we're talking about a medical Christing. So here's how we would look at this. In the ancient Greek pharmakon, that was the language that was used during the time of Jesus' time in the Bible and 1,000 years before, as you can see. Exact same relation. I've done several videos on this already. So here we have the pharmakon broken down really easily. A drug that can be applied outwardly as ointments or plasters. The ointments are the Christs, and the plasters, well, are the plasters. You can do inwardly. You can eat them, or you can drink them. So standard stuff that we have today. So this guy tries a cortisone Christ for however long, looking for what? Soterias, salvation, deliverance from psoriasis. So he decides to do the outward approach. The cortisone Christing failed miserably. So he comes to a pharmacos. He comes to me. I'm a pharmacos. I go, that didn't work. All right, I got an oral thing for you. Here's what we're going to do. We are going to go oral. How would you pronounce this? Brosima. We're going to go brosima. I think that's how you'd say it. We're going to do an eatable, as you can see. Brosima, the eatable, for deliverance, preservation, and salvation of psoriasis. So what we're going to do, we're going to use 35,000 international units taken every day, per day, for 6 months. That's what we're going to do. What do you think is going to happen for this guy? It's so magical, the dude might think it could be an enchanted potion. It was just going to be oral vitamin D. This is a true case history, by the way. You'll see how to get deliverance, how some people can get deliverance from psoriasis. Boom. How's that? 6 months of this caused this. That is some serious deliverance. So what was the situation here? Well, the medical Christing with a medicated cream failed, but the oral vitamin allowed the patient to achieve salvation and deliverance from his disease, or certainly put it into, well, a repressed state. So where did I get this from? Cool paper. You can go right online. A pilot study assessing the effect of prolonged administration of high doses of vitamin D. Not saying this is for everybody. This is not a recommendation. It's just an example of how the pharmacos should be understood and the broad pharmacos that they used back then, right? They had Christings, there were ointments, there were medications, they had plasterings, they had eatables and drinkables. This would have been an eatable. And you can see 35,000 IUs per day for 6 months, low calcium diet. The main thing is to keep your calcium within the normal range. But if you want to do this, just go get with the doctor and do it with him or her. But anyway, now you understand a better way to view a Christ in a very clinical, normal, modern day sense versus all the holy roller bullshit that we get fed from the apologists and the believers.